Hello, good evening, and welcome to the last part of our series of lectures on inflammation and repair. As mentioned, I split um, the chapter on inflammation into two major groups. The first group talking about acute inflammation, and the second group of lectures talking about chronic inflammation and repair. The reason why I lumped these two together is that these two processes are very closely intertwined, and it's impossible to talk about repair without talking about um, the process that takes place between um, during chronic inflammation. And in fact, you will see later on that the chemical and cellular mediators in chronic inflammation are more or less the same. Um, we're talking about tissue repair. So for this lecture, we will be talking about the different um, stem cell types in relation to their ability to repair and to reconstitute themselves. And we will also know um, what are the requirements for a tissue to be able to regenerate itself successfully. We'll also talk about the different phases of wound healing, particularly as it involves the skin. We'll also be talking about primary intention and secondary intention. And then we'll also be talking about the factors that can cause a delay in wound healing and possible complications that can arise from faulty wound healing. Now, the goal of the repair process is simple, and it is to return the tissue to its original state after the inflammatory reaction has been cleared. Um, we know that the inflammatory reaction sets in motion by the injury contain. So the goal of the process of repair is simple, and it serves to restore the tissue to its original state after the inflammatory reaction. We know during the inflammatory stage, um, a lot of collateral damage has taken place within the tissue in order to contain um, whatever has caused the inflammatory process. So part of the inflammatory process, aside from killing the organism, is of course to contain it, as what we have talked about last time. So also part and parcel to that is to try to repair what has been damaged during that phase of the inflammatory response. Now, some tissues can be completely reconstituted after an injury, such as um, the bone after a fracture or regeneration of the surface epithelium in a cutaneous wound. However, there are tissues that are not capable of regeneration, and since the body cannot repair the injury by reconstituting it with the same component cells that was originally in the tissue, it will try to replace it with connective tissue, specifically collagen, thereby producing scars. Okay, so essentially, this is what happens. So when there's superficial injury, or if the injury is mild, and the cell population is capable of reconstituting itself, then um, there will be regeneration or complete repair. Okay. However, if the injury is severe and the architecture is damaged, um, instead of regenerating the component cells, the body will fill it up with collagen, leading to the formation of a scar. Now, at this point, it is important to recognize that we have two major components of the tissue, generally speaking. This was already mentioned before in histology, but we know that the tissue is composed of the parenchyma, which are the cells that make up the main body of the organ, and the stroma, or the connective tissue compartment or the supporting framework of the parenchymal cells. Now, the connective tissue is important because it serves as the framework, it serves as the skeleton for and support of the parenchymal cells. And in fact, it is In fact, it does not just play a secondary role in the tissues. What it does is it plays an equally important part in the growth and the development and the repair of the tissue. Because what happens is, if ever there's damage to the stroma, the parenchymal cells will not be able to regenerate itself. Um, Now, this diagram shows us what happens, um, shows us the different scenarios that can result after inflammation. If the stimulus causing the inflammation is removed and the tissue framework or the stroma is intact, then the stroma will provide the framework for the complete regeneration or the um, complete replacement of the cells that were lost, and this is called the regeneration. And again, the most important concept here is that there is complete repair or complete restitution of the normal structure. So, for example, if you take out a piece of the liver after partial hepatectomy, um, the liver will just grow back. Okay, if it's a superficial skin wound, the skin is going to grow back after a few days. Okay, now if um, the parenchymal cell death is so severe, and this leads to tissue damage to the tissue framework or damage to the stroma, then instead of trying to reject, this means that there is complete damage of the parenchymal cells, including the stem cells from which the parenchymal cells will arise. So as a result, the tissue architecture is destroyed. You will no longer have stem cells to try to replenish the loss of the cells, and as a result, newer cells arising from the stem cells can no longer be made kay na destroy man siya because of the extent of the damage. So instead, the body is going to try to fill it up, to fill the defect out with collagen, a connective tissue molecule known as collagen, and this results in scar formation. So this is the reason why if you have very deep wounds, what's going to happen is, instead of complete restitution, if grabe ang imuhang samad, you will form scars instead. Okay? This is also particularly true in cells that can no longer divide or cells that do not have stem cells. Okay? And this is seen in the heart after myocardial infarction. So if for some reason you survive the heart attack, okay, so there's infarction, so the cardiac cells will die, but let's say you were managed on time. What's going to happen? You will still have the dead cells, okay, but the cells that have died will be replaced by scar tissue, which is not capable of contracting, which is not capable of conducting electricity. And as a result, patients who survive myocardial infarction usually have a very high risk of developing arrhythmia or irregular conduction of the heart, which can also be fatal. Okay? Now, if the damage is severe enough, if the damage is slow but persistent, what's going to happen is you will have concurrent damage to the tissue na dili kaayo severe, but at the same time, the body is going to try to repair itself. So this constant process of repairing and chronic damage will, of course, damage the normal architecture of the tissue, leading to abnormal deposition of connective tissue, and we call this fibrosis. Okay, and you can see this in chronic inflammatory states. Now, a good example to show the difference between regeneration and fibrosis is um, the liver. Okay, you take a piece of the liver during surgery, malinis yung pagtanggal sa lobe. So, going to happen is the liver will regrow that part of itself that has been removed. But, for example, if you have chronic damage to the liver, chronic alcoholism, um, high intake of fats, so that's going to cause oxidative damage to the liver. So, chronic persistent damage. So, what's going to happen is this will cause damage to the architecture, but at the same time, as a regenerative organ, um, the liver will try to attempt to heal the damage. So this constant process of damage, repair will destroy the normal architecture, and as a result, in cirrhosis, you will have faulty healing, you will have fibrosis, and you will have a nodular liver. Okay, magpo-form siya ng nodules sa liver because faulty ang wound healing. Now, um, the ability of the organ or tissue to repair itself is dependent on the type of stem cells that, or the type of cells that are present in the tissue. Okay, you have labile cells, which are cells that continue to proliferate throughout life. So these include the squamous epithelium of the skin, the columnar epithelium of the gastrointestinal tract, the transitional epithelium of the urinary bladder, um, and cells of the bone marrow. Okay, so these are called labile cells. They will continue to divide and divide and divide. And these are the cells that, these are the tissues that have the greater capacity to regenerate themselves. Okay, we also have stable cells, and these are cells that do not continuously divide. Normally, unlike sa labile cells, that there is continuous um, turnover of cells. Like for example, sa skin, what's going to happen is you have the stem cells in the stratum basale. They will mature to form the stratum cells of the spinosome, granulosome. Over time, they will lose their nucleus, and they will make up the um, cells of the granulosome and the corneum. So until they become shed out, okay? Or the cells of the intestine. So you have the crypts of Lieberkühn, divide to form the an overlying epithelium of the colon, and then after a while they get shed out. Pero sige ang pag-divide niya, continuous ang replacement. Okay? Now, in stable cells, there is no continuous cell division. Okay? They will only divide when there is a need to. So for example, sa liver, you take out a piece of the liver, it's going to grow itself back. Okay? So that's an example of a stable cell. Permanent cells are cells that cannot reproduce themselves after birth. So these are cells na when they get damaged, they will no longer have the capacity to heal itself. So as a result, you will develop scar tissue. So examples include neurons and the cardiac muscle cells. Now, this photo shows us, of course, the cell cycle. You have the G1, S, G2, and the M phase. Okay, so for labile cells, these are cells that continuously go through the cell cycle. Okay, so those are the labile cells. The quiescent or the stable cells are cells that are normally in a G0 phase, but when there is a need to enter the cell cycle, they enter it through the G1 phase. Okay, and you have the permanent cells, which do not enter the cell cycle at all. Okay. So these are examples of um, stem cells. So for example, the cells of the stratum germinativum or the stratum basale are actually stem cells that can either develop to become the keratinocytes of the epidermis or can develop to become the adnextral structures of the dermis. Okay, so it can develop, but these are the stem cells that will populate the cells of either layer of the skin. Okay, the cells of the crypts in the intestines will also act as stem cells to replenish the cells of the enterocytes. Okay, now healing is said to be a tissue response either um, after wounding the skin, after inflammatory response in internal organs, or after cell necrosis. Okay. So this is an example of an ischemic infarct. Sorry. Of an ischemic infarct. So you have the wedge-shaped infarct leading to coagulative necrosis. Okay, so you have the acute tubular necrosis here on the right, coagulative necrosis. And since there is limited capacity to repair itself, especially if medyo deep yung ischemia, then the body is trying to repair it by formation of scar tissue. Okay. Now, repair actually begins early in inflammation. So at the site of inflammation, cells that produce collagen, known as fibroblasts, start depositing collagen. At the same time, there is the formation of vascular channels by endothelial cells. Okay, the formation of new blood vessels, um, and the formation of fibroblasts and the secretion of collagen by fibroblasts leads to the production of specialized tissue. So if you look at it under the microscope, you actually have a lot of new capillaries that are being formed. New capillaries tend to be leaky. So as a result, there's some degree of edema in the tissue. But if you look at it under the microscope, the presence of new capillaries, fibroblast deposition by collagen, and edema, that picture is actually telling you that the body is starting to try to repair itself. And this picture, new capillaries, collective collagen formation, or collagen deposition, is known as granulation tissue. Okay? The formation of granulation tissue is a process known as organization. Now, granulation tissue, as mentioned, is fibroblast formation of collagen, formation of blood vessels, and macrophages and other inflammatory cells to try to contain or to try to clean up the debris left by the inflammatory state. Now, aside from cleanup functions, macrophages also secrete cytokines that will signal other cells to go into the sites, particularly fibroblasts and angioblasts. Angioblasts are the precursors of endothelial cells. Okay, they also stimulate matrix production. And then as a result, they will also secrete other substances or other cytokines that serve to remodel the scar to try to remove the excess collagen formation. Now, let's go back to one of the key players of chronic inflammation, which are the macrophages. We know, diba, that macrophages. Now, the macrophage, as mentioned, when activated by cytokines, particularly interferon gamma, um, can either tends to gain more cytoplasm. The monocyte becomes differentiated to become tissue macrophages, and they also secrete additional cytokines which will orchestrate the chronic inflammatory reaction. Now, this process wherein the monocytes become activated is known as the classic activation pathway. Okay, this is known as the classic activation pathway, and its purpose is try to push the immune system to proceed to the chronic inflammatory stage. Now, the reason why I'm bringing up the macrophages is that macrophages also play a very important role in trying to suppress that chronic inflammatory state and instead shift the milieu or shift the environment to a non-inflammatory state while trying to repair itself. Now, this is known as the alternative activation pathway. Okay, alternative activation pathway. Whereas the classical pathway is mediated by interferon gamma. The alternative pathway is activated by IL-4 and IL-13. So IL-4 and IL-13 are anti-inflammatory cytokines, and they lead to the secretion of growth factors which facilitate tissue repair and fibrosis, and the formation of anti-inflammatory cytokines. The migration of fibroblasts to the site of injury and the subsequent proliferation are triggered by multiple growth factors, but the one key um, cytokine to remember here is TGF beta. Okay, so TGF beta stimulates fibroblasts to synthesize collagen and fibronectin and decrease degradation of the matrix by metalloproteinases. Okay, now as the repair process goes on, less and less endothelial cells and fibroblasts are recruited. So, and this results in um, a decrease in collagen formation. Okay. So, as mentioned, granulation tissue formation occurs early on in the inflammatory stage. It actually occurs towards the latter half of the acute inflammatory stage. Okay. So, as mentioned, it's a proliferation of new blood vessels or new endothelial cells, which are leaky, um, fibroblasts, which serve to deposit matrix, and macrophages, which serve to clean up the area. Okay. Now, how does uh, how are new blood vessels formed? Well, are new blood vessels are formed when there are stimuli produced by precursor cells from the bone marrow. Once there are certain cytokines that are released, particularly vascular endothelial growth factor, these precursor cells or these EPCs or endothelial precursor cells move from the bone marrow to the sites where they need to form new blood vessels. Okay, and this will lead to the secretion of substances, which will cause the branching out of the endothelial cells. Okay, mag-branch out siya. Now, scar formation promotes further healing through the deposition of collagen um, and the formation of new blood vessels. Okay, so this is a um, time chart of what happens. So inflammatory stage by overlap with granulation tissue formation. Over time, the granulation tissue formation becomes replaced with collagen, and because collagen is contractile, the wound will actually contract to try to close it. Okay? After a while, the collagen is destroyed by metalloproteinases and the scar tissue is removed. Okay? The ECM is much more than a space filler. It does not only to fill out the spaces seen in the wound, but it also provides support to the tissue and scaffolding for tissue renewal. Okay? Now, um, there are two types of wound healing as it pertains to the skin. So there is primary intention or healing by primary intention and healing by secondary intention. Healing of primary intention is when the incisions are clean and there are no bacterial infections. So ang best example ani is operating room. So there is minimal loss of tissue kay nindot ang gisi sa tissue. So as a result, um, the tissue actually closes very well, okay, and healing is very good. Secondary intention or healing by secondary intention is usually what we see kung na-infection, pangit yung cut, or a very large yung wound. So as a result, um, there is a very large defect that is formed, and as a result, there is scar formation. Okay, so this is actually just a rundown of the inflammatory phase and the healing phase. So this should be familiar. No need to repeat it. Okay. Now, there are different types of collagen that are secreted in different phases of the healing process. So at first, it's collagen type 3, but over time, this is replaced by collagen type 1, which is the stronger type of collagen. Now, this is a very, very common board exam question. For some reason, examiners love this. By the end of the third month, the tissue approximately has 80% of its original strength. So what this means is that even if nag-heal siya by scar formation, it does not go back to its original strength. Maximum is 80%, which it will acquire by the third month. Okay? This is a picture of granulation tissue. You have a lot of blood vessels and then edematous stroma. Okay? And then this is a trichrome stain. Itong blue. Okay? The blue is actually collagen. Okay? So secondary intention, as mentioned, this can be seen in large gaps. Okay? So there is scar tissue formation, collagen deposition. So why is healing by secondary intention not as good? Because the edges are far apart, it's much more difficult to oppose, and because of that, mas paglisod siya close. Inflammatory reaction is usually more severe, and scar tissue formation is much more intense. Okay. Now, what causes delayed wound healing? The most common causes, number one, is infection. The presence of foreign bodies in the wound. This is particularly true, for example, sa OR. You have mga sutures that are left, mga hilo that are left. And as a result, the body will identify them as foreign objects. So there will be granuloma formation. This is known as a suture granuloma. Mechanical factors and nutritional deficiencies, especially if you have vitamin deficiencies. Usually, the vitamins that are crucial to wound healing are those that are involved in collagen formation. So usually vitamin C and zinc. Okay? This is the reason why if you have a deficiency of vitamin C, you will have faulty collagen formation, and as a result, you tend to bleed in your mucosal surfaces, particularly in the gums. Vitamin C deficiency is known as scurvy. Okay? Poor blood flow, of course, will cause delayed wound healing. Excess corticosteroids, excess steroids, because it's anti-inflammatory, it will actually lead to the formation of more cytokines, anti-inflammatory cytokines, which will diminish the strength of the scar. So what are the complications in cutaneous wound healing? So we have poor scar formation or excessive formation and the formation of contractures. So here, this is known as a wound dehiscence, dibuka ang wound during post-op, because there is usually an infection or something there that prevents enough collagen deposition. You also have wound ulceration as a result of infections. You have excessive deposition of scars, and this is genetically programmed. This is known as keloid. Okay. Sometimes excessive ang scar tissue formation, and we know that collagen type 1 contracts. So as a result, mo-contract ang skin and the muscle. So this is known as contracture, and you see this in severe burns. Now, keloids are excessive scars composed of irregular hyaline collagen bands. They appear as bulging masses. Okay. Apart from keloids, there's also a term known as hypertrophic scar, and essentially, usually sa exam, you will be asked to differentiate what is the difference between a keloid and hypertrophic scar. Okay, so essentially, ang keloid extends beyond the borders of the original wound. Hypertrophic scar remains within the boundaries. Okay, that's it for our session today. Thank you very much for listening, and I will see you for the exam on Thursday. Thank you.